Hello guys, welcome to another marking criteria. Today this video is specially on implementation marking criteria. So in this video I'm going to describe exactly what you need to do when you are doing implementation criteria. In this criteria, I will also let you know about the red flags, so that you will not commit those red flags when you're doing your implementation, so that you will stick to the rightful thing. So if you're interested in knowing what are the red flags and the tips I'm going to give you for you to pass your implementation, stick to this video, share it, subscribe to my channel, so that we can continue giving you videos. So let's continue on this. On the implementation marking criteria, the first thing you need to do is to clean your hand with alcohol hand rub and wash with soap on water and dry with paper towel following WHO guidelines. If you don't do that, it's automatically fail. The second thing is you introduce yourself. Hello, my name is Nelson. I'm the nurse going to take care of you today. Is that right? Take consent. That's why seek consent from the person or carer to administration of medication. If you didn't seek consent, it look as if you are forcing them to do or take the medication. They might tell you no, they are not ready. They're not ready to listen to you, and you cannot do anything more than that. Okay, the next point there is check for allergy. Some medication contains some allergy, and some people react to medication differently. Some medication contains some substance that might lead to allergy. Okay, so seek and clarify if there is allergy. Some might be allergic to penicillin, so if they prescribe anything that contains penicillin, do not give it to them, because if you do so, it's automatically fail. Now, before administering any prescribed drugs, look at the patient's or person prescription charts and correctly check all of the following. 1. The person. Identify, check for identity with the person. You check the wristband, you check your paper, you check the wristband, you check your paper, you check the wristband, you check your paper. Okay, and verbalize against the wristband and also documents. Now, how do you do that? Okay, you say, my name is Nelson, or can I know your full name? You ask for the full name, and the person will say, okay, my name is Potter Ash. You check on the paper and you check on the wristband, it's written Potter Ash. Then you check also the ID and date of birth. You also check the hospital number. If you can meet up with this, that's fine. Either you check the date of birth or you mention both of them. You check the drugs. Okay, you read out drug number one is so. If it's penicillin, you say the route, you say the dose, you say the dates and time of administration, the route and the method of administration. Then if it's require dilutant, you also say that this drug supposed to be dilute with so and so that, but believe me, they're not going to give you that in Osce. Now the next point is correctly check all of the following. Validity of the prescriptions, signature of the prescriber, prescription is eligible. If any of this piece of information is missing, unclear, or illegible, the nurse should not proceed with administration and should consult the prescriber. Now, consider contraindication where relevant and medical information prior to administering this medication. Okay, this is where you apply your nursing knowledge, medical knowledge, to know that this drug is contradicted. Like for pregnant women, there are some drugs they will not take, like a patient who is allergic to penicillin and they prescribe penicillin. You don't need to go ahead and give the penicillin because they have prescribed it. You are the nurse. You're supposed to spot out this issue and raise it and tell the prescriber that this resident or this patient is allergic to this, so he should not take this kind of medication anymore. All right. You consider that you provide a correct information or explanation of what each drug being administered is for to the person in their care. Now, it's just like when you bring out paracetamol and you tell the person, "Oh, Mr. A, this is paracetamol and is for pain. Okay, this medication is for pain, and as you complain, you are in pain, and I have scored you, and you require, and I have also checked the time. The last um paracetamol was given is up to 4 hours, and I'm happy to proceed." Okay, so this is how you explain. If they prescribe fusamide, you say, "Oh, this is fusamide is diuretic, it makes you go and have a lot of wee or have a lot of pee." Okay, then you also confirm the blood level, because this can bring down the blood level, blood pressure of a patient. So you ask, what is the current BP of this particular person? Then you move on to administer drug due to administration currently and safely. When you are giving medication, there is a way you give it. You pop it this way and check the ones, or if you can do the trick, you put it this way and you select as they are dropping. You know already the one you are going to select, and you give. Some of the residents might feel like, "I want it one by one," or "I want it all." You pop out your medication, you set it, each one you pop close to the bottle you remove it from, so that you can know the one you are giving and explain, "This is this is that." And remember to mention the expiration date of the medication, the dose. Okay, and say that this drug does not contain any substance that can make the person allergic. If you didn't say all these things, some of these assessor, they might fail you, because if they fail you, they are right. It's their right to communicate to your patient that these drugs you are giving them does not contain anything that can cause allergy to them. So we're moving into an omit drugs. Omit drugs are not to be administered and provide verbal rationale. Any drug you omit, okay, you should do what? You should explain why you omit it and the reason why you should not proceed to give it. Then accurately document drug information and non-administering, including the detail of the person administering the medication. Now, there are a points in the sheet. If you are giving the medication, you as the nurse administering the medication, there is a place you will do what? Write yes, that you are the one prescribing this, so you have to sign your signature and write your name. Okay, then act professionally throughout the procedure in accordance with NMC code 2021. This is very, very important. Now guys, let's us go to the red flag. Those things that if you didn't say or didn't do, it will cause a problem and is automatically fail. Now the red flags goes this way. If the candidate failed to acknowledge the author or communicate effectively. For example, there is no or minimal eye contact. Has their back to the patient. You don't need to do that. You can never back a patient in any situation unless you are giving medication. But even if you are giving medication, you are trying to pop out the medication, you should be in a position that you also communicate with the patient that, "Oh, I'm not leaving you, but I'm just trying to get this done." You can also be washing. Then you stand in a position that you can also be seeing and washing or looking at those side, make sure that everything is okay. All right. Then if the candidate ignore or fail to check allergic status and risk causing the reaction period to administration of medication, that is automatically failed. That means before you give, you have to confirm 2 times. You do allergic check when you're doing introduction and when you come back to give the medication. Don't just rush and give. You also have to verbalize, "Can I confirm if you're allergic to this?" You confirm again, you cross check it again, and you now explain to the patient that the medication you have there does not contain any substance that can cause allergic to them, that if the candidate make a drug error during the administration of medication, that is automatically fair. If the candidate fail to accurately sign and date the drug chart, that is fair. If the candidate fail open if the candidate openly display judgmental behavior about a patient's personal character like sexuality, religion, belief, and rest of them, that is automatically fair. You shouldn't have been judgmental if a candidate physically cause intentional harm to the patient through restraint or unnecessary procedure. That is fair. Another red flag issue identified by assessor, all those ones that is not mentioned here. If the assessor feel like there is something you say or something you do which can cause harm or fail during the procedure, the assessor have the right to fail you. Now, guys, let me now tell you the tips you should employ when you are doing medication. First, when you finish doing ID check, okay, quickly ask the patient if he's allergic, and if he's allergic to anything, just make sure that you communicate it to other nurses and document it that this patient is allergic, and note whatever is allergic to. Then also ask if the patient is on pain. If the patient is not on pain, move ahead. If he's on pain, quickly do pain assessment immediately. When you do pain assessment immediately, you also grade if the patient needs any painkiller. If the patient keep telling you, if you keep hearing I'm in pain, I'm in pain, be careful, because there may be a trap. The trap there may be this way. Maybe that someone have already administered that medication, painkiller, and is not up to 4 hours. So if you go ahead and give, it's automatically fair, because according to the drug law, you should give painkiller, especially paracetamol, 4 hours gap before you give the next dose. Sometimes they might even putting it in the scenario that this particular patient have taken IV fluid. If you are not careful and you say, oh, there is no tablet, paracetamol tablet, and you give from the PRN, my dear, is automatically fair. Another thing you have to be careful on, sometimes they might prescribe cocodamol and paracetamol. This drug contain the same thing. Cocodamol is codeine and paracetamol is paracetamol. Now, when they put it together, it becomes cocodamol. That is paracetamol and codeine joined together. So if any of these particular medication have been administered before, you should not administer it again until 4 hours gap differences. Okay, so guys, be careful out there. The next thing that will help you to meet up with the time is if you can read all the pages fast, fine, but the easiest way to do it is this way. When you read the first page from beginning to end, now you tell the assessor you're going to check if the same information you are having there is what appears on all the pages you have. Guys, with this is gonna save you a time that you will never expect. What you will do now, if you flip the first page, you will read out the name of the patient. If it's still the same thing, you say, I can confirm that I have the same information in this page. You move again and read out Porter Ash. I can see I have the same information on this page. But make sure you read out the first page very, very well, and each of the pages you are reading out the name loud, and also tell them that all that information are the same. Just be fast and fast. With that, you can beat up. Remember, if you forget any medication and you want to know information about it, quickly go to your BNF. BNF will be there. It might be in a paper or in an iPad waiting for you. So practice very well. Practice, practice, practice. In my next video, I'm going to do the practical aspect of it. This one is just like a criteria for you to know. So in my next video, I'm going to do a practical and you see how the whole thing, and I'm going to time myself for it. So guys, if you like this video, please kindly subscribe and share to your friends. Thank you so much. Love you, God.